Hi, I'm Wendy Griffith. I'm a nurse practitioner student at Iowa University. In 2020, this is one thing that you don't want to catch, the COVID-19 virus. So let me tell you a few things about COVID-19. It can be defined as a respiratory infection that's characterized by a dry cough, low-grade temperature, fever, chills, muscle pain, sore throat, and a new loss of the sense of taste or smell. When we look at the pathogenesis of COVID-19, we consider three different stages. The first stage is asymptomatic, the initial 1 to 2 days after a person has been infected. This is when the virus binds to the epithelial cells in the nasal cavity. The ciliated cells are the primary ones that are infected. A patient can have a positive nasal swab at this stage but be asymptomatic. During stage 2, the virus propagates and migrates down the respiratory tract along the conducting airways, and a more innate immune response is seen at this stage. Positive nasal swabs do occur at this stage, and early markers of the immune response can also be detected. At this time, COVID-19 is clinically manifested, so the patient is sick at this point. During stage 3, this is the most severe stage, and a patient can experience hypoxia. Ground glass infiltrates can be seen on x-ray, and a patient can also progress into acute respiratory distress syndrome. The virus has now reached the gas exchange pathways in the lungs, and the alveolar cells are affected. COVID-19 propagates within type 2 cells in the alveolar sacs, and a large number of viral particles are released, and cells undergo one of Dr. Moore's favorite terms, apoptosis, and die. For the epidemiology of COVID-19, we know that field investigators traced the virus back to a seafood market in Wuhan, China, and that bats were found to be the original reservoirs of the coronavirus. For the morphology of COVID-19, we know the particle size ranges from 70 to 90 nanometers. There's a surface viral protein spike membrane and envelope of coronavirus are embedded in host membrane-derived lipid bilators. And this is a model that I made of the virus. When we consider laboratory tests that are needed in diagnosing COVID-19, we can look at two different types: molecular, which is the RT-PCR that detects the virus's genetic material, and also antigen tests that detect specific proteins from the virus. Clinical manifestations you can look at in 3 different stages. During the incubation period, this is the first 2 to 14 days of the illness when the symptoms begin to develop. During the initial presentation, this is when you see the dry cough and the low-grade fever occur. For the course and complications, usually about 80% of people recover at home without incidents. The other 20% have a more severe course of illness and require hospitalizations. And usually these are the people with coexisting illnesses like hypertension, diabetes, COPD. Complications of the disease can range from respiratory failure, cardiac, and embolic events like a pulmonary embolism, and also a severe neuro complication can be encephalopathy. Recovery and long-term sequelae can range from a mild case from 2 weeks to more severe cases can be 3 to 6 weeks or longer, depending on how sick a patient was prior to contracting the infection. Treatments are supportive. There is one drug that has been approved right now called remdesivir. That's an antiviral drug that can be used in patients that are hospitalized. The COVID-19 pandemic has affected me as a student because I had decreased clinical sites to choose from. In the future, I know we'll be educating nurses about COVID-19.